Hello, everyone. My name is Allison Peters. I am a registered respiratory therapist from Tallahassee, Florida. I have been a registered respiratory therapist for about 10 and a half years now. When I first graduated from my associate program, I moved down to Central Florida and worked at a really big teaching hospital in the adult population for about 3 years. I worked mostly specifically in critical care. And then I moved back up to Tallahassee, and I've been working at my current facility for almost 7 years now. My current job position is the chronic lung disease navigator. I have been in that role for about 4 years, although I did leave it to go back to bedside during COVID and then came back to it. My position is basically to consult on patients that are admitted for chronic lung disease exacerbations, so mostly COPD and asthma. I see these patients and I have a questionnaire for them. I talk to them about their disease. I provide education about these chronic lung diseases, how to manage them, why inhaled medications are super important, the importance of pulmonary function testing, how to use inhaled medications properly. I also see other patients too. Sometimes I'll do education for patients with obesity hypoventilation syndrome, or chronic tracheostomy patients, or patients admitted for interstitial lung disease, pulmonary fibrosis, or sarcoidosis. So I see a lot of those patients and sit down with them and have the long conversation that physicians don't have the time to give them about what the disease that they have is, how to manage it, and also sometimes educate them about signs and symptoms of an exacerbation, and then also provide them with resources to use outside of the hospital, prescription assistance information to the pulmonary clinic, to see a lung doctor, etc. My favorite dessert currently, I'm obsessed a little bit with chocolate chip cookies and ice cream, or basically any dessert that you can like warm up and put like ice cream on top of it. It's delicious. So warm brownies, ice cream. Also, I'm Southern, so I do love me some cobblers with ice cream on top of it. Those are pretty great. The most challenging part of my professional career lately has been networking, or not necessarily networking in a sense that it's in order to take care of the patients that I see, it is not just me talking to the nurse and the physician, it's me talking to other respiratory therapists, it's me talking to residents and educating them on the gold standards on how to manage these patients. It is asking a lot of questions to case management and the pharmacist, and getting to know a lot more about inhaled medications. It is networking with drug manufacturers to understand like any prescription assistance programs and any new inhaled medications that are coming out. So that has been the most challenging thing. Also realizing that developing a program and seeing success in something that I do is going to take time. That has been a big struggle for me as well, because I'm so used to seeing people breathe better right away as a therapist, and so this is something that I kind of had to really reframe my mind on how or my expectations for how it was going to go. Boise State has contributed to my professional growth by helping me be more professional as far as researching information. So whenever I do talk to physicians about protocols or medications or medication regimens, I have the information and science to back it up. And I believe Boise State really, really helped me implement that. Professional writing as well. I could not write a paper to save my life, and now I feel like I could write something down, I can cite information, and I can present it to somebody, and it makes me look really, really smart. I believe I am a smart therapist. However, I want to be smart on paper as well, especially whenever you are networking and reaching out to people that you've never had a face-to-face conversation with. You need to be able to look smart on paper as well, and I really do think Boise State has given me a leg up on that. I'm really looking forward to this class. I'm looking forward to talking to my fellow classmates and kind of building the capstone project and stuff. And it's my last class, my last semester, so I graduate after this class, and I'm really looking forward to that. So I hope everyone has a great day, and I look forward to working with you all.